Good morning, everybody. Welcome to another Mancoll Minute. We're in the heat of the summer. What a great time to be around here. So I hope you're enjoying the outside. So I got an interesting question, or at least a comment that made me think about a question that I get in one shape or form on almost every consult. And that's kind of like, all right, I'm in my 20s, I'm having plastic surgery, or I'm in my 30s, and I'm here for breast surgery, lipo, tummy tuck, whatever. What's long-term is it going to be like? What's going to happen down the road? And like most people, we never think of our body as changing, but our body is. So just like a facelift won't make us look 20 again, and it doesn't stop the effects of aging, when you have plastic surgery at one age, our body will continue to change and evolve, a decade or 2 or 3 later. And there isn't always a predictable way that's going to go. I think I'm pretty safe to say that if you have a breast augmentation in your early 20s and you go on to motherhood, have a few babies, that your breasts get bigger, then the skin tends to relax, and most augmentations will not hold up after pregnancy the way they did before. Those hormones have a dramatic effect in how your body responds, so the skin might be looser and hangy, there may be more fat. Or the opposite, you may lose a ton of fat, especially breastfeeding, and now, what didn't look like an abnormality of your implant might seem like an abnormality. So it's kind of hard to really predict it, I guess, when I summarize it all up. But it's sort of, your needs will also change. That's the other thing is, again, I'll use the breast augmentation patient as a good example. There's a lot of folks who come in who are looking for that bigger breast, fuller look and shape. And then as they go on 20, 30 years later and it's time to remove those implants, I'll say, okay, do you want to put an implant? They're like, no, I've had my time with big breasts. I'm looking forward to sort of less weight and things easier for me. Now, granted, a lot of those folks have also put on weight, not necessarily significant, but a pound or two a year over a decade or two can add up to 15, 20 pounds. And on some people, that's pretty significant weight. So their breasts naturally got bigger just simply as they got older, and maybe hormones peaked in their younger age and then start to go down as you get closer to menopause. So now their breasts are already plenty big and they don't need an implant to get the look they were looking for, or they just simply have a different desire. So what I would tell people is, for things that we're making bigger, and it's usually the case versus things we're making smaller, you can't always know what you're gonna want down the road, 20, 30 years. Just like fashions change, so do our sense of what we like for ourselves. So I would tell you, you're doing plastic surgery, cosmetic surgery now for as much of the now, and not so much worrying about 20, 30 years from now, because things will absolutely be different. But things like tummy tucks and facelifts, where we're tightening things that otherwise got loose, you can be pretty sure you'll be happy about those 20, 30 years down the road. Because the hangy skin, the looseness, the wrinkles that we're unhappy about today are only going to get worse down the road. So I kind of break it into those two parts. When I'm making things tighter, when they're loose, people will always be happy long term. And when I'm sort of making things bigger, I kind of wonder what they'll be like down the road. So I'm not sure there's a single answer to that question. It's pretty philosophical and pretty deep when you kind of get into all the layers of it. But hopefully for those who sort of thought about that, it might offer a little bit of insight for you. And I'm happy to talk to you more about it. If you want to come in, make an appointment, we can look at your particular situation and see what not just the now might be for you, but the decade or 2 or 3 down the road for you. Have a great weekend.